Phases of wound healing. The wound healing process is often divided into three major phases. There is overlap among these stages. The first stage is inflammation. The initial phase of wound healing. This includes blood clotting and local blood vessels dilating, allowing various cells and processes into the area that promote wound healing and prevent infection. This is the stage with the most physical symptoms, including pain, swelling, and redness. Second stage is proliferation. During this phase, the tissue is rebuilt as a new tissue and blood vessels develop. During this process, the tissue looks uneven and reddish. The third phase is maturation or remodeling. This is the final phase and starts during the proliferative phase. During this process, which may last for months, the scar that was formed is remodeled into more regular tissue.